Hello everyone, I'm Dr. Prachi Kulkarni, fertility consultant, 49 Fertility Center. Every day when we meet patients in the OPD, most common complaint is irregular menses. So today I'm going to talk about irregular menses. So what are the conditions which can cause irregular menses and why it is important to evaluate why your periods are irregular. So the most common cause for irregular menses, what we see nowadays, is polycystic ovarian syndrome. You all must have heard about it. So it's an endocrine and metabolic condition where there is an inadequate levels of FSH and LH hormones from the brain, which causes abnormal or inadequate development of the eggs in the ovary. As the eggs don't develop properly, there is no release of the egg from the ovary or absence of egg release from the ovary, which we call anovulation. So the cause of irregular menses in PCOD is anovulation. So as the egg is not developing properly, the hormone levels, which are estrogen and progesterone, which come from the ovary, are also inadequate, which leads to not normal development of the lining of the uterus and acyclical and untimely shedding of the lining of the uterus, which results in the irregular menses. So the most common cause for irregular menses nowadays is polycystic ovaries. As we know that this is a lifestyle condition, so it's important to get it evaluated, and there are many other associated hormonal imbalances or other health issues which are related to PCOD. So it is important for you to visit a fertility consultant and get yourself evaluated for your irregular menses and to rule out polycystic ovary as the cause of irregular menses. Now coming to the second cause, which is also related to hormone levels, which is thyroid. So any woman who has a very low thyroid level or very high thyroid hormone level can also have irregular menses. So very low levels is it's called as hypothyroidism, and high levels are called as hyperthyroidism. So both these conditions can result in irregular menses, can disturb your other hormone levels and result in irregular menses. So if you have irregular menses, you need to also consider evaluating your thyroid hormone levels. Third cause for irregular menses is another hormone, which is prolactin. Prolactin is also secreted by the brain from pituitary gland. This prolactin hormone level can be disturbed by intake of certain medications for a long time, like some psychiatric medicines or some acidity tablets. If you are experiencing any breast discharge which is watery or milky, or if you're breastfeeding your child, your prolactin levels might be raised and you may experience irregular cycles. So the cause for irregular cycles can be hyperprolactinemia. Most often, this condition is treated with the medications, but sometimes if the prolactin levels are too high, like above hundreds, then there might be a requirement to consult a neurologist and to rule out pituitary gland tumor, which is called as microadenoma. So this is a third cause for the irregular menses. Now coming to another important cause of irregular menses is maybe somebody who's, even if they are young, they may have a lower egg reserve. So the patients who are having egg reserve on the lower side also experience irregular menses because the egg reserve is going down. The FSH-LH levels are also very high. They tend to develop ovarian cyst very often. And if these ovarian cysts are functional, also it causes irregular menses. So you need to get your egg reserve checked by certain blood tests like AMH or second day or third day FSH and LH hormone levels, and also your ultrasound scan, which will tell about your egg number, that is antral follicle count or AFC. So this is another cause for irregular menses. Few more causes which are also known, they though might be rare, but you should be aware, are some eating disorders like bulimia nervosa or anorexia nervosa, where the patient feels she has an abnormal body image where she may end up binge eating and followed by induced vomitings, or she may not be eating adequate food. So these are called as eating disorders. So they may also disturb the FSH-LH levels and result in irregular menses. Sometimes too much exercise or very vigorous and strenuous exercise also may result into irregular menses. So these are the causes for irregular menses. If you are having irregular cycles, irregular periods, you need to get evaluated for the reason why you are having this problem, and accordingly you should get treated. So do visit your fertility consultant for a proper guidance and treatment. Thank you.